Hey guys, it's Dr. James Kennedy, Texas Foot and Ankle Centers. I have a patient here, and she is a very young woman. We did x-rays. X-rays were negative. She didn't have any problems on the x-ray that I could see. She's had a little bit of arthritis in the past, but nothing really big. Young woman complaining of pain on the top of her foot. Well, I looked, she really doesn't have any real bone spurs here, maybe a beginning of one right here, but really not a big deal. And so I asked her if it was more of a deep pain in the ankle, and she said no. And by looking at it, I think she has more of an anterior tibial tendon pull. I don't think there's a tear because she definitely does have pretty strong strength plantarly and dorsally. So if you take a look at this foot, okay, basically you have to make things real simple, you have 4 different sections of tendon and muscle on a foot. So you have your anterior side, you have your medial side, your lateral side, and your posterior side. So if you take a foot, this right foot, and you actually strip the skin down, here's what you have. You have the anterior muscles, that makes you dorsiflex the foot. You have the posterior muscles, that makes you plantar flex the foot. You have the medial muscles like the posterior tibial tendon, that can make the foot roll inward medially. And then you have lateral tendons, which can actually pull the foot either in a plantar flexury motion or it can pull them laterally. So if you're looking at tendon sprains, you can have it more of an anterior, posterior, medial, or laterally. She's actually complaining of pain on top of the foot. So I made her tippy toe. She didn't have any pain here. And then I actually told her to pull up. And when she pulled up, she had pain around this insertion site. So if you look at this right here, okay, on this foot, you have the anterior tibial tendon. She was having pain at this bend and at the insertion site. So what can you do about that? That's something simple that doesn't require surgery. If you know anything about me, I try to desperately get patients out of here without doing a surgery. So what can she do at home to decrease some of this pain? So what I tell my patients, either use a jump rope, which is simple, or get you one of these small TheraBands. And what I like to do is have the patient tilted. You put this TheraBand along here. It doesn't hurt, it's not painful. And how can you do this by yourself? Well, you can tie a knot into this TheraBand and then put it on like for example, a door handle similar to something like that. So Debbie, show them that door handle. You can put it across that. And then when you do this, you kind of want to pull it laterally, then you want to pull it medially, then you want to pull, centrally and then medially. So laterally, centrally, then medial, okay? So if you do this, and if you look at it, this is at the opposite direction of where I'm pulling. So if you pull up like this, and you want to make sure this doesn't pop in your face, so I usually put my hand right here. So if you go up, perfect, and then go back down, then go back up, perfect, and then you go back down again, then go up again, perfect. Try to do that. Don't kill yourself on this. Try to do this 15 or 20 times a day, and then you want to shift it to where it is, in rectus right here, and then you want to go up dorsally. Okay, 1, go down, 2, go down, 3, go down. Do that 15 or 20 times, and then this may not help as much, but again, you're stretching some of these some of the lateral tendons and some of the dorsal tendons here. So you'd go like this, and you'd go up, okay? Then you'd go down, then up, and you'd go down, then up 15 times. Take that with a good anti-inflammatory. Usually somebody as young, as healthy as her, she would do great. Okay, thanks guys for watching. Bye-bye.